And good morning once again. It's time for Senior Talk, brought to you every week, this Monday morning, that is, by Harbor Place, located at 3700 Southeast Jennings Road. This morning we're joined by, as always, Dianne McDonough. She's their Director of Sales. And good morning, Dianne. Would you please introduce our guests today?
Yes, sir. Good morning to all our listeners on the Treasure Coast. Paul, did you know the state of Florida proclaims January 9th through the 13th as Florida First Responder Appreciation Week?
I didn't, but I surely do now.
So go out there this week, buy a police officer a cup of coffee, bring donuts or bagels to your local fire station, or simply say thank you for all they do. Harbor Place appreciates first responders for keeping our community safe. Harbor Place is a continuum of care campus with independent living and assisted living, with our sister community Life Care Center of Port St. Lucie. We are proud to have served our community with experience for the past 15 years. I have visited with many seniors who live in their own homes, who have fell, or they had a stroke, or didn't feel well. And our faithful first responders assist and bring them to the hospitals. From there, rehabs are recommended with either PT, speech therapy, or occupational therapy. Today, our special guest is Kara Chappell, Director of Rehab, and Kathy Gunter, Speech Pathologist. And we have Adele Angola. She is the Director of Business Development. We're proud to have them on our show today. They are from our Continuum of Care campus at Harbor Place, Life Care of Port St. Lucie. Good morning, Kara, Kathy, and Adele.
Good morning.
Good morning.
Morning, ladies.
Kara, please share with our listeners the services, rehab services you offer at Life Care Center.
At Life Care Center of Port St. Lucie, we offer physical therapy, occupational, and speech therapy services. Our physical therapists are able to assess abilities of ambulation, which is walking and balance, transfers. We also complete wound healing. We also look at prosthetic use and management. We also look at orthopedic aftercare. And our physical therapist also completes lymphedema therapy. Our occupational therapist look at assessing activities of daily living, such as ADLs. Also what's called IADLs, which is looking at homemaking tasks, looking at ability to complete activities that they would do prior to having an injury or going into the hospital to our facility. We look at wheelchair positioning and self-feeding management. Our speech therapist provides services for swallowing, cognition, and voice disorders. With regards to those services, some of the teams that we have available through our 3 different disciplines is our cardiac team, our neuro team, our vestibular team, and our wound care treatment team. One of the areas that we are going to discuss in depth today is going to be for the Parkinson's patient. One of the programs or modalities that we're able to treat is through the LSVT Big and Loud program.
Fantastic. Let's talk about a few other things before we get into the LSVT Big and Loud. Tell me more about your cardiac team and your neuro team.
Our neuro team and our cardiac team consist of 1 PT, 1 OT, 1 CODA, and 1 PTA, and then 1 speech therapy. And what happens is once we get patients that have the cardiac diagnosis and or a neuro diagnosis, they get placed on this team where assessments can be completed to ensure that we're identifying any deficits and or those around them, that we're able to address the deficits to be able to get them back to prior level of functioning.
Or some of the symptoms, is this strokes and heart attacks or?
Correct. For cardiac, it can be CHF, which is and or COPD. For our neuro team, it's looking at strokes. I'm trying to think of other different diagnoses besides stroke.
Mostly it would be a stroke or a TIA.
Correct.
Okay. And what kind of physical therapy would you offer for someone with strokes or occupational therapy?
Those deficits will be addressed based on the assessments that are completed, and they'll be individualized per resident's deficits. It's pretty hard to determine what each resident's going to need until the actual evaluation is completed to determine the deficits.
Okay, fantastic. I know that sometimes I visit seniors at their own homes and they have wounds. And if you can tell us more about your wound care.
With regards to our wound care, we're able to complete what's called a type of a debridement called closed pulse to irrigation. It's actually a water debridement that the physical therapy does in conjunction with the wound therapy team that we have at our facility.
Your pain management interventions.
Some of our pain management interventions include E-stims, type of a diathermy machine, ultrasound machines, as well as some soft tissue mobilizations.
All right. For those who don't know, and I'm going to say I may be one of those, vestibular therapy. Can you explain that in detail?
Sure. We have a certified vestibular therapist on staff. That therapist is going to be looking at different deficits within the vestibular, which is typically the ear, that which would cause vertigo and or balance impairments, which leads to increased risk of falls. So once that patient is able to come into our facility and we identify that it could be a vestibular issue or vertigo issue, we absolutely get that resident onto that therapist's schedule, and they can assess to determine what would be the next best intervention for them so that they're able to return to prior level of function with increased balance.
You know, most of you may not need any of these services right now, but you may in the future. I know I fell and I fractured my patella and I had to have physical therapy. I have had family and friends all of a sudden needing physical therapy, occupational speech therapy. And prior to that, I didn't even realize how important it was to our lives. So everything you're learning today, take it at heart, and also try to visit Life Care to learn more about it. So let's talk more about the specialty area that we wanted to discuss today, LSVT big and LSVT loud for Parkinson's disease.
And we're going to let Kathy Gunter, she's the speech therapist pathologist, that will be discussing this with you.
LSVT big and LSVT loud are developed specifically for Parkinson's patients. LSVT loud was the original program, and it was developed. It stands for Lee Silverman Voice Training Program. Lee Silverman was a Parkinson's patient whom she was treated by a speech pathologist who took a strong interest in her and developed this program. It's based on over 20 years of research, and from LSVT loud, LSVT big was formed. LSVT Loud is a very simple voice training program based on daily exercises that are rigorous but very simple. They appear very cookbookish, but they are based on significant research. And if the therapy program is followed, we have found that the carryover lasts for 2 years following discharge from the program. The LSVT Big for physical therapists and occupational therapists is for increasing the body movements, ambulation, movement of arms and legs. It's very functional, and again, it's based on a very intensive exercise program that is quite simple, but involves a lot of daily exercise. The patient has to be very dedicated to the program, motivated. It is actually, in my over 35 years of clinical experience, it's the only program I have found that truly works with Parkinson's patients.
It's my understanding that it also helps with other ailments that you may have. Do you know any of those? Is it
any kind of muscle movement disabilities you might have that is weakening of the muscles? It's up to the therapist, the individual therapist, to assess the patient and see if this particular program might apply. It was developed for Parkinson's, but I have definitely used it with patients who don't have a specific diagnosis of Parkinson's. And the same for physical therapy.
I hear great things about it. When you use the LSVT Loud, I've watched some videos on it. It's they may have hoarseness, they might stutter, they might speak very low, am I correct about that? Which causes them to talk less because they don't think people are listening to us.
Yes, and we do an assessment in the beginning with the patient to see how this affects their lifestyle, and 99% of the time they're talking less because they get tired of repeating themselves. And with Parkinson's, you have a poor feedback system, meaning that you think you're talking loudly enough, but you're not. So one of the things we have to overcome initially is a patient's ability to monitor their own feedback, because when they initially use what we call the loud voice, they feel like they're shouting, and they're actually not shouting, they're just audible. We can hear them. So the program is based on instant feedback, meaning when they leave the therapy room the first time, they have 10 functional sentences they will practice every day, but they will use the moment they walk out of the therapy session so that they can address people using this loud voice and getting the kind of feedback which is positive. For instance, if they say hello, they get a hello back, and they don't get someone who jumps back because they think they're too loud. So they have heard themselves and felt the way they talk for so long that the effort it takes to speak loudly enough feels uncomfortable. So we have to get them out of that discomfort and into a comfortable zone where they know that they're just speaking audibly.
I watched a video about this elderly lady. She lives at home, and she says it was during the holidays. She's sitting there, and she says, everyone ignores me because they can't hear me. The only time they can hear me is when I'm yelling, and I don't want to yell, but I don't think she's yelling.
No, and a lot of people say, well, when I get mad, I can be heard. And I said, that's the voice we need. We need your angry voice. So it is. It's just, like I said, you get used to feeling the way it feels with your voice. And that's the biggest obstacle we have to overcome.
Okay. And let's see, I'm going to give you some facts about Parkinson's, and this is why this program is so good. Facts and figures. Parkinson affects up to 1 million people in the United States. Doctors are diagnosing as many as 60,000 new cases each year. Parkinson's strikes 50% more men than women. The average age onset is 60, but can appear at any age. Parkinson's disease is common in the elderly and affects 1 person in 20 over the age of 80. The cause of Parkinson's disease is unknown, but estimated 25% of people with the disease have a family member who also had it. Ladies, do you have any comments about those facts and figures and how your program really helps with those folks with suffering through Parkinson's?
9 out of 10 Parkinson's patients have voice problems, and it's intelligibility, but the intelligibility, meaning being able to be understood, is usually affected because of the loudness of the voice. And with the LSVT Loud program, it improves the speech intelligibility through improving the articulation or the clarity of the speech. It also actually improves facial expressions. With Parkinson's patients, oftentimes there's a facial mask is formed, which is where the facial muscles are not being utilized as much because of deterioration and immobility. And through this program, you can actually see a change in the facial expression because those muscles are being exercised.
Onto the LSVT big and the big movements, and that's the exercise. When should one start this program if they have been diagnosed or if they think they're being diagnosed? When do you start this program that would be so it can be more effective for you?
Really, as soon as you're diagnosed, because when you learn this program for LSVT big or loud, which they're both exercise programs, and I always tell patients it's like with the loud program, it's like PT for the voice, PT for the throat. But once you learn this program, it's a certain number of sessions, and then you go home and you continue this program on a daily basis. So if you've been diagnosed, you come in, you learn this program. It's fairly short. It's a matter of weeks of intensive, usually 3 to 4 times a week for 4 to 5 weeks, depending on scheduling. which we also do see outpatients for this and all the other disabilities we address. But you take it home and you have it. It's yours. So you use it forever. We advise people to come back usually in 2 years for a refresher. And that's usually how long the program lasts before the person needs to come in for a refresher. So this is not a forever come to therapy program. It is one of the shorter programs. And like I said, it's effective. And many neurologists, they won't refer a patient with Parkinson's unless it is for LSVT, loud or big, because they don't see a real strong outcome for a lot of effort.
I've met many seniors with Parkinson's, and they have problems with falling, and their gait is not good. So your big program, from my understanding, helps with fall prevention. So when they finish your program, they go back to their everyday life and use what they learned to help them with that, and it improves their gait. And that's so important to anyone. And so it's my understanding is that LSVT big is working your core muscles as well.
Absolutely, yes.
And explain how that's done.
Well, because you're using big muscles, you're doing big movements, you have to address all the muscles in order to do a general large movement. And if you do a stance like you're standing and you put your right leg out and your left arm straight up, it takes all your muscles in your core to do that, which involves your balance. Balance and vestibular problems, they can be coexisting with your Parkinson's disease. So it addresses everything in a very simplistic program. Like I said, it's cookbook-ish, but it is in no way simplistic in the research that has been done.
I have a question for Kathy. People obviously listening right now are probably wondering, what is this going to cost me? Is insurance involved? Can insurance be involved? Social Security? What can a person look forward to in terms of helping assist in paying for this program?
All right. Hi, this is Kara, the Director of Rehab. With regards to the inpatient person, it's covered under the insurance that they're in the facility for. If you come to us on an outpatient basis, again, it's insurance driven. So if you have Medicare typically covers 80% of the outpatient costs, and then there's a remaining 20%. If you have a secondary insurance, that typically covers the remaining 20% of the 80%. However, in some cases, they cover 80% of the 20% left over. So what we would ask is that if anyone has questions with regards to insurance, please let us know, and we can have the business office run your benefits, and then that way you will know exactly what is covered prior to ever starting any type of therapy services.
I know we'll get back to this before we're all through, but what's the phone number down there?
My direct line into the therapy department is 772-380-1512.
All right, Kara, tell us more about the physical therapy end of it in reference to the LSVT big.
Sure. Our therapy program is 4 times a week, and it lasts 4 to 5 weeks, as Kathy had said. It's looking at movements. It's looking at how far you're walking. Are you shuffling your gait? Where is your balance, to the right or to the left? Are your arms not swinging during the swing phase of your walking aspect? So the physical therapist will assess all of that, and then they will determine what type of therapy session is needed to address the deficits that you have, because everyone's Parkinson's is at a different stage, I would say. So everyone's deficits are going to kind of be a little bit different.
Okay, great. Before we go on a break, Adele, tell us about the address, the location, your website, and if someone wants a tour.
Hi, everyone. Again, I'm Adele. I'm the Director of Sales and Business Development. Life Care Centers of Port St. Lucie, as Dianne had said, is located in the same campus as Harbor Place. We are the building in the front. It's 3720 Southeast Jennings Road, Port St. Lucie, Florida, 34952. The phone number is 772 888-398-8080. To tour the facility, it's simply a matter of walking in the building. All you have to do, you can call to schedule a tour, or you can just come into the building, and we will take you around. I missed your other question, I think.
That's okay. So if I'm interested in the program or any program in your therapy department, take me through the steps again. What should I bring when I come to see you? Or should I call you first? What should I do?
If you are interested in therapy, what you would need to bring in, if you have been in the hospital, a lot of our patients are discharged from the hospital to home and may notice that they need a little bit more help in getting more mobile. Maybe it's speech therapy that's needed, occupational therapy, or physical therapy. So if you have your hospital records, bring it in with you. We do accept Medicare, as Kara had stated, as far as payment for the therapy service. We also accept Blue Cross Blue Shield and Aetna. If you have your insurance cards, again, coming in and taking a tour, but we can actually look at your benefits, because I know sometimes the cost factor is a huge consideration for these type of services. You may have a loved one that's in the hospital at present, and the providers have mentioned the potential for rehab following discharge. Pre-planning is also a great reason to come in. You may have mom or dad, or in my case, my fiance's grandma that's having a knee replacement. So coming into the facility ahead of time, so this way you know your options. And we do have a great therapy program, as well as the setting of the rehab. It's a beautiful building it's very cleanly, and phenomenal staff.
I can tell you, Diane, a few years back I had both my knees done the same time, knee surgery. And when I had a chance to go to therapy, I went the first day. And it was rougher than I thought, but quite frankly, after I don't know how many sessions I went to, I was a brand new person. And I go back occasionally just to kind of get, caught up again.
You're right.
And I can tell you that nothing replaces it. I mean, it's absolutely essential. So as we go on today, certainly if you have any questions, feel free to call us here. Our phone number is 340-1590. We'll be breaking in about a minute or so for news, but Diane, if you want to say about 30 seconds or so before we go to news, go ahead.
Great, thank you. So today it was nice to introduce Harbor Place and Life Care at Port St. Lucie. I know we do this weekly show every week on Monday at 10 o'clock, and I have guests, mayors, political figures, police department, anything to do with senior living. And to me, it was important to start the new year introducing our community and giving you a better understanding what Harbor Place has to offer, and also at Life Care at Port St. Lucie. And again, if you'd like to tour Harbor Place, the number is 337-4330. And if you want to see independent assisted living, it would be my pleasure. And then I can walk you over to Adele over at Life Care, and you can tour that facility as well. Thank you.
Thank you, Diane. We're WPSL, Port St. Lucie, Florida. And good morning once again. It's about 10:34 right now. It's about, let me see here, 52 degrees outside, and we are back with Senior Talk. Diane is our host this morning. She has three lovely guests with her, and I will let her introduce them right now. Diane?
Thank you, Paul. Once again, we are back on Senior Talk, and we have three guests here, and they're all from Life Care Center of Port St. Lucie. Kara Chappell, the Director of Rehab, Kathy Gunter, Speech Pathologist, and Adele Ansola, who is the Director of Business Development. Good morning, ladies. Adele, can I ask you a few questions about your skilled nursing? I know we talked about rehab on the first part of the show, but it's my understanding you have about 115-bed skilled nursing and long-term care.
That is correct. In addition to our rehab, we do have long-term residents. If I can just take a minute and differentiate where the differences are. Most individuals hear nursing home and think of that long-term care. We do have allocated beds for long-term residents. This is where someone may be in the home setting, or maybe have been in the facility for rehab and maybe not progress to the point where they can return to their prior level of functioning in the home setting. In that instance, we can keep that resident at the facility in a long-term bed, and that's where they're pretty much living there. The majority of our residents are there for rehab, short-term rehab. So in essence, what would happen is you may have an individual that had some sort of an event that led to a hospitalization. Being at the hospital, this is anywhere from a fall, infection, we're in cold and flu season, pneumonia, or maybe surgery, planned surgery, elective surgery, or if it's even not scheduled surgery. Having been in the hospital, there may be conversations that are had with the provider. The physician may say, you need rehab. At the rehab, what we're looking at is, if you, again, with the insurances that we accept, Medicare, Blue Cross Blue Shield, and Aetna. What we're looking at, if you are a Medicare resident, is have you stayed 3 nights in the hospital? You would meet your 3 nights. Our admissions department would receive your information from the case managers at the hospital, and we evaluate for appropriateness. Not only are we making sure that your condition can be managed at our facility, but we're also making sure that our facility can meet your needs, because our goal is to provide the speech therapy, the physical therapy, the occupational therapy, in addition to skilled nursing, to get you back to a functional status so you can return home. So specifically skilled nursing, what are we doing? We do have nurses 24/7. We are staffed 24/7 with a combination of LPNs on RNs. And if there is a need for antibiotics, if you can think of the care that you would receive if you've ever been in a healthcare system in the hospital, they're doing pretty much those same things. But I don't want to say it's a downgrade because the care is not substandard, but it is a downgrade. It's not as high acuity, the care, as you would have had in the hospital. But again, they're still managing your needs. You would transfer from the hospital to the skilled nursing setting with physician orders, and we continue those treatments at the facility. Our nurses can help. We do have a wound care nurse as well at the facility. We have managed wound vacs, which is something, if in addition to the closed pulse irrigation, that we can manage at the facility. We do have a cardiac physician that's on consultation at the facility. We do have a neurologist as well. So in addition to those 2 providers, we do have physicians at the facility that will see you there as well. That's pretty much it.
Great. As a director of business development, what does your job entail?
I think I have the easiest job in the building. And I say that to mean, that's why I encourage everyone to come over and take a tour. I'm a nurse by trade. Marketing is not new, but newer than my nursing career. And I've been in a lot of the area nursing homes, and we have one of the most beautiful campuses you will ever see. I joke because I said when I interviewed for the job not too long ago, I said if it smelled like a nursing home when I walked in, I was out of there. And it's clean. It's kept pristine. So my job really is education. I educate community providers, patients in the community, the hospital, case managers. And it's not only just about the building and the services that we provide, but also how do you know you need a nursing home? Because again, sometimes the misconception is, I don't need a nursing home. I don't want to be fed with applesauce. But it's really, my job is primarily education. Education in every area for any potential resident that may need skilled nursing services or even long-term placement.
So those who are listening that lives in the community, if they'd like to have Andeli or myself from Harbor Place come out and give you education about our continuum of campus, please give us a call. What is your number again there, Andeli?
The number directly to the facility is 772-398-8080. My number is 772-418-7200.
Thank you. Kathy Gunter, speech pathologist. Tell us more about your department.
Well, we treat patients who are in our facility as inpatients as well as outpatients. The majority of our caseload consists of patients who have swallowing problems, either long-term problems that perhaps have not been addressed or have become more significant. The cognitive problems, oftentimes after a patient has had surgery, especially if they've been under general anesthesia for any amount of time, they feel a little fuzzy-headed when they come out of surgery, have trouble with word finding, maybe short-term memory. And what we do is we go in and assess the patient and put them on intensive therapy so we can bring them back to the level they were in before the incident or the last hospitalization. Cognitive therapy runs the gamut of very mild problems to working with patients and their families who are in the later stages of Alzheimer's or just dementia itself. One thing that we do address at the facility is involvement of the family, because in our treatment, be it PTOT or speech, we're oftentimes there at a point when the family and the patient are having to make a decision of a difference in where they're going to live once they leave our facility. So the big word in any rehab department is safety and independence, but those cannot be separated. In order to be independent, you must be safe. And oftentimes we have patients come in that are there because of lack of safety. Falls because of poor balance, and most of these things happen when they're in the home, usually in the bathroom, bedroom, or kitchen. And so through our program, we teach the patient about safety. Sometimes the patients do not have good safety awareness, so we try to increase their safety awareness. And we work with the families with patients who perhaps are in the later stages of Alzheimer's with difficulties with dementia to try to decide what is going to be the safest, most appropriate, and most comfortable place for this person to live once they're through with our therapy program. And then we also, of course, treat voice problems with our LSVT Loud. And we've had a lot of success stories with that program. We've had patients who, when they start the program, won't pick up a phone because no one can hear them and they get tired of repeating themselves. They stop trying to talk to their grandchildren. I had one patient several years ago who her best friend said that the best birthday present she ever had was when she could actually have a conversation again with her with this patient. And then a lot of times we try to work in functional exercises, like maybe reading out loud to your grandchild, reading your mail out loud. We work on pitch, because with Parkinson's disease you have a flat tone because the muscles aren't working to raise and lower the larynx, which controls the pitch in your voice, so you have a very monotone voice. So it's not just loudness, it's pitch, it's loudness, it's the actual precision of the speech production. And once the program's over, you need to be able to do something when you go home. So we have the very basic exercises, plus we try to get patients to incorporate things like reading the paper aloud to their spouse, reading to their grandchildren, reading to themselves out loud, but something to keep this going on a day-to-day basis. And in addressing the cognition, no one would ever say, no speech pathologist or anyone would say you can cure dementia, but you can teach the patient compensatory strategies to accommodate their needs more efficiently. And if nothing else, we can help the family understand the disease, its progression, and working with that loved one.
Can you elaborate on that a little bit more, because dementia is a big topic?
Yes, and it's becoming bigger because we're all living longer. And so we have patients, we have had patients that have been over 100 years old in rehab. So, and we actually have, I've had patients whose spouses have come in driving, walking very well, that were 103. So we're seeing this more and more. And dementia can be very heartbreaking. My mother's 95 years old, and she is going through some of this. And it's a very difficult thing when it is your own family member. So in teaching the patient's family, a lot of it is just trying to teach them insight as to how the whole dementia process works, because every patient is different. And some patients, their personality changes, and that's especially difficult for family members. And it's very easy to take it personally. When I work with clinical interns in their graduate programs and we work with patients with dementia, you can get your feelings hurt because some things can be said that the person would never have said. And if that hurts a therapist's feelings it's in training, then imagine how the family member feels. So we'll do practical things, like we'll say, we'll come in at this time of the day to see your parent, your loved one, because this is the best time of day for them. Make your visits short. Don't argue with them. And that, again, is what stage you're in the actual disease process, because sometimes you can talk to the person, orient them, and bring them back. But you don't want to get to the point that you're in a debate, because oftentimes you can't change the person's mind, and you're just frustrating yourself and that person and upsetting them and yourself. So it depends on the stage, and that's where we try to help the people that are involved in the patient's care to understand.
Very good, thank you. Kara, please tell us more about your physical therapy department.
As discussed previously, our department has physical therapy, occupational, and speech therapy services. We provide therapy to the inpatient resident as well as the outpatient resident in the community. Our department is open 7 days a week for therapy services. Our therapy department actually follows a physician's order. So the physician is the one that's going to be determining how frequently they would like your loved one to be seen. A couple of the different types of services that we provide is what we have is called a Safe Transitions Program. What we do is we have the resident come into what we have is like a little cottage that has a washer and a dryer. It has a refrigerator, a stove, a little bedroom, and a bathroom. And we have them be able to cook a meal for themselves. We have them complete dishwashing tasks for themselves. We have them washing their clothes for themselves. Any type of task that they need to be able to do at home and complete, we want them to try it in our facility first so we can help work through any areas that we may offer for them. We may offer them to use a walker or a four-wheel walker to be able to carry items from point A to point B safely. We have them go into the bedroom and try to get in and out of a bed that doesn't have a handrail like the hospital beds do. Maybe they have a tub shower in their home. We have them make sure that they're able to get in and out of the shower safely or tub shower safely. If not, we also have them utilize the tub shower bench in the shower to make sure that they're safe prior to going home. One of the other services that we do offer is a home evaluation, where the therapist will take the patient home with them and or the caregiver that's going to be with them at the home and complete an assessment of the home. So then that way, the resident as well as the caregiver is aware of what may need to be moved, like rugs being pulled up, furniture being moved, Is the bathroom too far away from the bedroom? Do we need to put a 3-in-1 commode at bedside to make it safer for the resident? So we look at all different aspects. Our goal, once they are being discharged from therapy and back to the home and or to the ALF or to the independent living facility, is making sure that they're safe. Have we given them all the tools to be successful, that hopefully they don't have to go back to the hospital because they've had a fall? So with regards to that, that's pretty much a good overview of our therapy department.
Do these folks come back? I mean, is there a return visit? You obviously ask them to come back within a certain period of time?
They're always welcome to come back as an outpatient, as an outpatient once they have been discharged from our inpatient stay. Absolutely.
And they can feel free to call you with any questions or things of that nature.
Absolutely. And typically when they come back from the outpatient, if they've been discharged from inpatient and they want to come back as an outpatient, we just need the referral from the physician at that point in time.
Can I add to that? There are times that, like I said, someone may have been hospitalized recently and might have gone directly home from the hospital, but would have been at the hospital for 2, 3, 4 days. And feel that they need that extra support, they can call our facility directly instead of going back to the hospital, because we can take someone directly from home into our facility, as well as someone might have been discharged from our facility to home and even being optimized with therapy at our facility now have a new decline versus going back to the hospital again within that 30-day window. Call the facility and you can come direct. We can take you from home directly back into our facility. And that would be through our admissions department at LifeCare.
I did not know that. I learned something new. And Adele, tell us more about your contact information, website, telephone number, location.
Our website, lifecarecentersofportstlucie.com. Again, we are located on the same campus with Harbor Place, and that's 3720 Southeast Jennings Road, Port St. Lucie, Florida, 34952. The phone number, 772-398-8080. And again, I'm always welcome to phone calls directly, 772-418-7200. And I do want to add, Diane, my job is a mobile job. So if you do need, I will come to you. If you need information, if you need someone to come in, sit and explain services, what you are entitled to, how we can meet the needs. If you have someone that's at home, if you've been in the hospital and you have questions and maybe you can't come to us, definitely reach out to us and we can come to you.
Any upcoming events that you'd like to invite our listeners to attend?
Absolutely. We do have on February 13th, we are having a heart-to-heart. And that is with our new medical director, Dr. Panariot. It is open to the public. It starts at 5:30 to 7. There's no cost or no entry. Again, just opening our campus. You can come meet our medical director. If you have healthcare questions, bring those as well. February is Heart Month. So, again, we're having a heart-to-heart because we do want, again, our community to know that we are an open campus and they are welcome.
Fantastic. I know I've been over there visiting your residents and patients, and it's like, gosh, full of activities. It's almost like a cruise boat on land, but with the medical care. They're playing bingo. They're having all these arts and crafts activities, activities where they have discussion. And it's just not the skilled or long-term, it's rehab as well, yes. Which is nice because when I come over to introduce our community, they're already interested. Oh, what kind of activities do you have? Because you already instill that this type of living with assistance does have activities involved as well. So congratulations, your activities are great.
Yeah, I was going to ask, what's the size of your location? How many people can you accommodate? I guess, are you...
We're 115 beds.
115 beds. Okay.
Yes. And that's in addition to our long-term. So it's 115 total, and our rehab, it changes almost daily.
And once again, folks, if you have any questions or comments to make, feel free to call our station. The ladies would be happy to answer any questions you may have, or at least attempt to answer any questions you may have. Our number here, as always, is 340-1590. We've got a few minutes left, Diane. About 4 minutes left before we have to go back to the news, and this has been a very good program. Diane's always bringing in people who add to the fabric of our life, quite frankly, because we don't always have opportunity to hear of these kinds of things, honestly. I mean, we all go through trials and tribulations. And the older we get, obviously, the more those opportunities, if they call them that, arise. And the last few weeks, we've had people here, I think, who have been outstanding, giving us information that, if not for ourselves, for our parents, perhaps, or other loved ones. And so we will continue now for a few more minutes. And go ahead, Dianne.
Fantastic. Yes, my goal for this show was to introduce to our listeners Harbor Place at Port St. Lucie, the independent and assisted, but also our sister community, Life Care Center of Port St. Lucie, in which I think we did a great job. Ladies, you did a great job over there telling us more about the skilled nursing and rehabs and long-term care. But right now what I want to do is talk a little bit more about Harbor Place at Port St. Lucie. Yes, we do have independent and assisted living. What is independent living? I like to say it is a cruise boat on land. It has all the activities and services in place with minimal assistance. There's not medical care there, but our assisted living does have medical care. So if you can no longer live in independent living or alone, then assisted living is the place where you're going to benefit the most. And that's where we have standby assistance or hands-on assistance in our assisted living with 3 levels of care. Both independent and assisted living, we have 5 different models to choose from. We also have dining services available and so much more for you to offer. We want you to experience this. We do have an activity or an event that you can attend. It is on January the 24th. That's Experience the Lifestyle of Our Assisted Living Residents. On Tuesday, January 24th at 2 p.m., join us for a lovely garden tea party, complete with refreshments and music. It's right there out on our courtyard. It's going to be absolutely beautiful. Matter of fact, I'm out buying teacups now for this event. We want you to come, meet the staff, meet the residents. We're looking forward to meeting you there. On January 13th for Independent Living, if you want to come over, we have a Harbor Place Trivia Challenge. Friday, January 13th from 1 to 2 p.m. Test your knowledge. We're going to have teams of tables. And if you don't have a team, come on in. We'll match you with another. There will be prizes and refreshments. We have on January the 17th, Diet and Bladder Health. It's an important topic, and I've learned a lot from it. But we have Kara here at Life Care who's going to be presenting this. It's also presented by Gail. She's an OTR&R. What does that stand for?
She's an occupational therapist registered.
Tell us more about your Diet and Bladder Health seminar.
What happens as we all get older, we do have some difficulty with urinary incontinence. So this program is going to be looking at some of the items that we intake or ingest, such as caffeine and some other type of dietary consumptions that unfortunately increase our urinary frequency, which sometimes can lead to urinary incontinence. So Gail's going to do a great explanation about diet and as different exercises to help assist with decrease in urinary incontinence.
Well, thank you, ladies. It's been a great show, and I look forward to meeting you at Harbor Place, and we also look forward to seeing you at Life Care, visiting us and going through the tour.
Well, thank you, ladies. And Dianne, also, Dianne, you have a new leader down there now at Harbor Place.
Yes, we do. Her name is Erica Stewart. She's going to be joining our team at the end of the month. She is from North Carolina. She was here not too long ago, but she is an executive director at a community now, and she's going to be joining us. We're really excited to have her. There will be plenty of activities and events, so you can meet her as well. Thank you.
Thank you, Dan.